This is the third lecture in PHA 421, the second part where we're discussing study designs and the characteristics of study designs. Today's lecture is going to address the characteristics of our study designs that affect the quality, the rigors of the study designs, and therefore we're going to talk about the different types of validity and what are the things that impact or affect validity. So when a researcher set out to do a research, they should try to do their best to find the design that best addresses the research question. And therefore, depending on the research question, they can pick up different types of designs. Some research questions can be addressed using experimental design, and some research question requires non-experimental design to be addressed. Once the researcher picked the research design they want to choose, well, they have to do everything in their capacity to make sure that things are done correctly and to minimize what we call biases. There are three types of validity that the researcher should have to consider, and these are the statistical validity, the internal validity, and the external validity. You've heard me discuss internal and external validity before, and statistical validity is basically what you have seen previously in previous courses. This is the testing hypothesis, the p-value, etc., which we will do a revision in this course, but not for the time being. We're going to come back to statistical validity, how to analyze data, how to test hypotheses in a separate lecture. But today in this lecture, we're going to talk about the internal validity. And as we have addressed previously, internal validity is basically making sure that the study is set out to answer the research question appropriately, to measure what it's supposed to be measuring. You may remember that external validity is the generalizability of the results. And when we were discussing experimental design, we said that internal validity is best captured with experimental designs because you're going to put a lot of experimental control over the study itself, eliminating any kind of noise coming from other things beside the research experimentation itself. Now, does that mean that there aren't threats to internal validity? Yes, there are, and we're going to address these threats. What are these threats, and how can a researcher try to avoid these threats? I have here a list of threats or biases that are commonly introduced or discussed in the literature. We're not going to talk about all of them. We're just going to focus on some of them. These are the ones that you are responsible for in this course. So you can see that I have a list of 14 threats, I mean, and I'm only highlighting the ones that I want to talk about today in today's lecture. Basically, history, maturation, testing effect, instrumentation, selection bias, experimenter, let me fix that, experimenter, and mortality. These are two different biases. Diffusion of treatment, here we go, this is the experimental effect, and subject effect. So this is mortality or dropout, and we'll come and talk about each one of them as we're going through the lecture. Okay, so the first one we have is history, and what this is meant with is when you're doing a study and something that is external to the study affects the participants, and therefore you can't tell if the outcome that you look at is due to your actual study, your intervention, or is it due to the external event that occurred. So the example that I have in mind is there was a study that was conducted, and they were trying to see if a new policy or procedure is going to affect the satisfaction of the employee. In that year, what happened is that the minimum wage was increased by the government, and therefore the researchers could not tell if the change they observed in the satisfaction in their employee was due to the introduction of the new policy and intervention, or is it because of the changes in the wages that was introduced by the government. Well, obviously, this is a problem if you're running a non-experimental design or a quasi-experimental design, meaning that well, maybe you don't have a control group. All you have is the group of worker that were working in that specific area where you introduce your policy, and you don't have a control group to compare what happens in the other group, and therefore that would be a problem. Whereas had you had a control group to compare to it, then the history bias would be minimized. Obviously, the best thing to do would have been to do a randomization if you were doing an experimental design. But in cases where you couldn't do a randomization, then you would have to have a control group, and you would have to measure before the introduction of the intervention and after the introduction of the intervention, so that you can observe the change in both the groups and try to be able to tease out the effect of the external thing that happened that is not under the control of the researcher. Okay, so this is history. The second bias is selection bias, and this is a very common bias. By definition, selection bias is pre-experimental conditions differ between the two group. So you have two groups, you have the exposed and unexposed, or maybe you have the cases and the controls if you're doing a case control study. What happened is that for reasons, the two groups to start with are different with regard to a preset set of conditions or variables or characteristics. And these characteristics may impact the outcome of your study. So I think we have discussed the example of a study when they were trying to put participants in whether they received the surgery or the treatment. And what happened is that the physician were deciding on whether or not they pick who gets to go into the surgery and who gets to go to the intervention, I mean to the medication arm. And because surgeons were picking the good healthier patients to go to surgery, they ended up having a better prognosis, not because surgery was a better treatment, just because they were picking them better to start off. So that's a selection bias, but that's not the only type of selection bias that exists. There are other selection bias that exist that can affect any kind of designs. So a case control design, if the cases, remember, case control design is a design where the cases have the outcome and the control do not have the outcome, and then you're trying to ascertain the exposure in both the group. The best scenario for a case control design is that you pick cases that are representative of all the cases, and you pick controls that are representative of all controls. Well, if you pick your cases, therefore those that have the outcome, and if your outcome, let's say, is renal failure, if you go and you pick your cases from a tertiary hospital that is very expensive, only those living in the neighborhood of that very expensive hospital that have social insurance, social security, they have money, they are educated, and therefore the cases that you picked do not resemble your typical case. And you go and you pick your control group, and then your control group, you're picking them from, let's say, a setup where you end up picking those maybe in a different hospital, which is a hospital that is more visited by lower socioeconomical status. And therefore, your control in your cases are going to be inherently different in terms of socioeconomic status, in terms of education, in terms of a set of variables, not because it had to do anything with the fact if they were cases and controls, and therefore trying to figure out if there is a relationship between the exposure and the outcome, but because of how you selected your cases and your controls. And therefore, that would be a selection bias. A selection bias in a cohort. Remember, in a cohort, which is a prospective design, is where you select those that have the exposure and those that do not have the exposure, and you try to follow them up to see what's going to happen to them in the future. Well, again, if you're selecting your exposed group in such a manner that they have other inherent characteristics that you're not aware of, you're going to end up with a difference between them and the control, the non-exposed, not relating to the fact that they are exposed, but relating to other things. Therefore, selection bias is an important issue that researchers should always be aware of and make sure that whatever technique they're trying to select, uh, they have to make sure that their selection is non-biased. Um, in the second slide, I talk about the selection bias impacting mainly observational study. The reason is if you're doing an experimental study and you're able to do randomization, then you don't have a problem with selection bias. Even if you selected a group of people that do not resemble your typical cases, by the time you do randomization, your experimental group and your placebo group are going to end up looking like each other, even if they don't look like your typical case, but at least they resemble each other. And therefore, any differences that is going to emerge between the two groups is due to the fact of your intervention and not due to the fact of something else that is hidden between the two groups. Think about another type of design is we talked about it as the cross-sectional design. Think about a survey. Let's say you're doing a survey to ask question about مثلا um, um, satisfaction of LE students with a new policy or procedure. مثلا about the banning of smoking on campus. If you pick up only students, let's say you do your survey on مثلا Tuesday, and what you do is you go to the fountain area and you talk to these students. Well, you're running a risk of a selection bias, because remember, they are students that don't come to campus on Tuesdays because they're taking MWF courses. Also, there are students that you won't be able to talk to because they were in classes. Come in, there are students that are going to Beirut campus, etc., etc. Therefore, your sample is impacted by a selection bias, and therefore you might end up with results that are biased results. So, what is the best thing to do to stop selection bias? If it's an experimental study, make sure to randomize. If it's not an experimental study, make sure, depending upon what kind of design you're doing, is a case control design, that your cases resembles all other cases and your controls resemble all other controls. If you're doing a cohort study and you're selecting exposed versus not exposed, make sure that your exposed that are going to be recruited in a study look like your typical exposed, and the non-exposed look like your typical non-exposed. The third type of bias is called maturation, and this is a phenomenon that happens where your outcome is going to change regardless of whether you intervene or not. So مثلا example is if you're doing a study to look at stress, or you're doing a study to look at uh, uh, how people interact with each other, and you're trying to do an intervention to see if I can reduce stress, for example, among my employee or among my students or among my nurses working in the hospital, etc. And you know that when you recruit somebody new, they're going to feel stressed out because this is a new job, etc. And as time passes, stress is going to drop down no matter what. Therefore, if you fail to acknowledge that, if your study fails to address this issue, you're going to see a change that is going to occur in stress, and you're going to attribute it to your study or to your intervention, whereas in reality, this is something that is going to happen either way. There are two types of maturation. There's the short-term changes, and so there's short-term changes, and there are the long-term changes. So the one group before after design is particularly vulnerable. If you remember the one group before after design, this is quasi experimental, if not pre-experimental design, where you don't have a control group and you're not doing a multiple observation before and multiple observation afterwards. Therefore, you will fail to see what was happening before and what happened afterwards, and hence you're going to think that there is a change that occurred due to your intervention, whereas had you had a controller group, you would have seen the same change happening in the controller group. An example that one can think of is, and it's discussed in the literature, is, let's say you're looking at the effect of an ointment for the scar tissue. And so you have a group of people that have a recent masalan burn, and you're giving them this ointment to see what's going to happen and how much they're going to heal or how fast they're going to heal. And because you don't have a controller group, you're going to only look at those that you provided the ointment with, and you're going to look at the scar, and you're going to see an improvement in the scar, and you're going to say, well, this is perfect, wonderful, the ointment is working. Well, obviously you need a controller group to see what will happen to the scar in the absence of the ointment, therefore to be able to come up with a conclusion and say, well, okay, now in fact the absence or the presence of the ointment did help or did not help. The fourth type of bias is called testing bias, and this is where testing itself, and typically it's the pretest, is going to alter people's results. Think about the SAT. It's a well-known factor that if you take an SLT multiple times, you're going to perform better, even if you don't study. Just because you sit in the SAT the first time, so you get used to the environment, you get used to how it's done, you get used to the timing, you get used to the type of questions. The next time you're going to sit for it, you're going to do better. And maybe the third time you're going to do better. That regardless of what happened before the first time you took the test, the second time you took the test, and the third time you took the test. Therefore, if you have a group of people take the SAT, and then you bring them to you and you train them on the SAT, and you have them take the SAT the second time, you're going to observe an improvement in their SAT score. You wouldn't know if this improvement actually occurred because of the training that happened, or because of just the fact that they took the SAT twice. This is true for things that are also related to opinion on attitude. If you ask a group of people about a certain topic, let's say masalan abortion, or let's say a political issue, or things that have to do, as I said, opinion or attitude, it could be that you triggered their thought, you triggered their attitude, you triggered their interest in the topic. And though the first time they gave you an answer, because you tested them, because you asked them these questions, they might go and do more reading about it. They might discuss it with their friends and family. They might think about it more, and therefore they might even gain knowledge with this issue, or maybe change their opinion. And therefore, if you come and ask them the same question a second time, you will probably see a difference in their answers, regardless of anything that you would have done in between. So again, if I get a group of my students and I ask them a question about, let's say, an ethical issue for given or not given opioids for a patient that is in pain, and whether should I or should I not allow the patient to take opioid. And so the first time I'm going to get feedback from my students about this topic, it's going to be the first time they ever thought about it, and therefore their opinion is going to be with a certain type of opinion. And let's say they're going to discuss it among themselves, they're going to discuss it with other professors, or they might discuss it with their friends, or they might maybe listen to some podcast about the issue, and therefore they might change their opinion. هلا أنا in between I do a seminar where I discuss the issue, and then I invite my students to the seminar, and then I try to assess their opinion or attitude the second time. What happened is I'm gonna see a change in their opinion and attitude. I wouldn't know if the change happened because of my seminar, or because I triggered their interest in the topic. Again, notice here there's no controller group. So you need to have a controller group to figure out the difference. For testing effect, they talk about two types of reasoning of having testing effect. A learning effect, which I think everything I discussed so far is about the learning effect. There's also the experimental fatigue, which kind of is the opposite of what I said. If you test people a lot of time, you may gonna start seeing a fatigue that is going to happen. مثلا let's say I'm نعمل an IQ test, and let's say I want to do an IQ test every week, every week, every week, every week. Here I might see maybe at the first time, the second time, the third time there might be some learning effect, but the fourth and the sixth and the seventh, maybe students start to get fatigued, and therefore they might get me different results. Okay. Um, so what you ought to have is you ought to have a reduction between or I mean, yeah, reduce the number of tests you're going to do. And if you're going to, if you can get the time between the first test and the second test, typically the pre-test and the post-test, if you can make it long, then that would be a good thing. You will see that in the slides, the first test and the second test is called the pre and the post, because remember, pre-intervention and post-intervention, because that's how me as a researcher, I'm thinking about these two tests.